when we look at the subset of people who are at highest risk for hemorrhagic strokes, the far more germane question is not underlying coagulopathy. The far more germane question really comes down to blood pressure. Blood pressure would be the first, second, and third driver of that. So hypertension is hands down the leading driver of hemorrhagic stroke phenomenon.
Welcome back to Biohacking Insights. In today's episode, neuroscientist Andrew Huberman is joined by Canadian-American physician Peter Attia, renowned for his longevity medicine work and dubbed by the Wall Street Journal as the favorite doctor for biohackers. They'll discuss simple ways to manage your blood pressure and key facts about hypertension. Disclaimer: this video is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. Seek the assistance of healthcare professionals for any such conditions.
So if blood pressure is both less systolically than 120 and diastolically 80, that's considered normal. So 119 over 79, normal. 121 over 79, technically not normal. Elevated is when the systolic pressure is between 120 and 129, but the diastolic pressure remains less than 80. So we talk about elevated blood pressure as a slight elevation in the systolic, but not the diastolic pressure. And then we get into two stages of hypertension. The first stage is when systolic blood pressure between 130 and 139, or diastolic blood pressure is between 80 and 89.
Think of your blood vessels like pipes. When the pressure inside those pipes is too high, it's called hypertension or high blood pressure. And think of your heart like a pump. When it squeezes and pushes blood out into your body, it creates pressure in your arteries. This pressure is called systolic pressure, and it's like the high point in your blood pressure reading. So when you see a blood pressure number like 120 over 80, 120 is your systolic pressure. The heart takes a little break between beats. During this break, the pressure in your arteries goes down a bit. This lower pressure is called diastolic pressure, and it's the lowest point in your blood pressure reading. So in a blood pressure reading like 120 over 80, the 80 is your diastolic pressure. Stage 1 hypertension means your blood pressure is consistently between 130 to 139 over 80 to 89. It's like your pipes are getting a bit strained. Stage 2 hypertension is more serious. It's when your blood pressure goes between 140 over 90. It's like the pressure in those pipes is too high, which could lead to some serious problems if not managed.
What sort of blood pressure levels do you like to see?
We're very aggressive, right? I mean, if you look at the SPRINT trial, I think it's very clear that 120 over 80 or better is the place to be. And that's better than 130 over 85, which used to be the standard. Exercise doesn't move lipids that much. Like, you're heading down the path of pharmacology much sooner on the lipid front. But blood pressure is just as big a risk factor for cardiovascular disease as lipids. Losing weight and exercising will fix a lot of people's blood pressure.
The SPRINT trial included a large group of adults aged 75 and older, and according to the National Database for Biotechnology, a separate analysis confirmed that lowering blood pressure reduced complications of high blood pressure and saved lives in older adults. As with the overall study population, even for older study participants who had poorer overall health. Also, high-stress individuals would benefit a lot from saunas or hot tubs because of the impact on those conditions on hypercortisolemia and its indirect effect on blood pressure. If you're learning something useful, please leave a like and subscribe to our YouTube channel. Doing lots of these activities and also running, staying fit, being super healthy, and donating blood seems to normalize the blood pressure. Blood donation probably works because you're getting rid of the iron and hemochromatosis. Green shakes help a lot too, but they don't necessarily taste great. Blend a bunch of healthy green vegetables because it's good for your heart. Cocoa flavonoids also make an excellent option for reducing high blood pressure. The data is still insufficient to fully understand the direct impact of flavonoids, or all the suite of B vitamins that are necessary to lower homocysteine and their impact on blood pressure. But here's what scientists can confirm. As homocysteine is elevated, It impairs the clearance of something called asymmetric and symmetric dimethylarginine. Homocysteine is associated with poor outcomes in cardiovascular disease. Dr. Huberman confirms that when you directly inhibit nitric oxide synthase in the endothelium, you are preventing the creation of nitric oxide, and of course, that's what cocoflavanols do. The synergistic combination of lowering homocysteine and raising nitric oxide synthase activity via cocoflavanol could certainly explain a reduction in blood pressure. Another way to keep an eye on your blood pressure is that people at home should just get an automated cuff to make sure everybody's measuring correctly. Measurement errors are a huge problem, so you need to learn how to use it right. So make sure you contact your cardiologist for professional advice.
Quite in line with the most recent available data on blood pressure, and that basically with each subsequent blood pressure trial, the data are becoming clearer and clearer that the more aggressively you manage blood pressure to be within the 120/80 range, the better. So, there's a recent study that even looked at going from what used to be considered acceptable, which was 130 to 135 over 80 to 85.
120/80 range is the goal you want to reduce heart attack and strokes. Sitting at the top 3 undiagnosed problems is high blood pressure, which has the highest mortality rates in underdeveloped countries of the world. How you get your blood pressure measurement right is by sitting still for at least 5 minutes. Then you take your readings. To do it right, do 2 measurements for 2 weeks and calculate the average. The 3 major risk factors are controlling blood pressure, avoiding smoking, and maintaining regular exercise. Another important factor is apolipoprotein B, ApoB, a protein in humans that is commonly used to assess the risk of atherosclerotic cardiovascular disease, which involves the buildup of fats, cholesterol, and other substances in and on the artery walls. Our goal is to see how much we can lower blood pressure without medication before we turn to medication. And let's be clear, the meds today are so much better than they used to be. Again, there was a day when the side effects of these medicines were horrible. That's simply not the case today. That brings us to this crucial point: exercise. But if we could get a person to lose 10 pounds in exercise every day, we see great effects with Zone 2 workout, the low-intensity cardio. Sleep is an important piece, so get the sleep right and get the exercise right. If that doesn't work, then we've got pharmacotherapy as a final resort.
Weight management is a huge one here. So, you take a person who's blood, and this is one of those things where we don't immediately jump on the pharmacotherapy train with blood pressure, because here there are side effects sometimes. And you do have to worry about overshooting. If you overshoot somebody's blood pressure medication, you trade one problem for another problem. They become lightheaded when they get up to pee at night. They fall and bang their head. That's a devastating consequence.
There's something that Dr. Adia mentions on the Huberman Lab podcast that doesn't get much attention, yet is so important. That's the effect of high blood pressure on the kidney and also the brain itself. We've talked about the brain, we've talked about the heart, but the kidney doesn't get enough attention. The kidney is made up of thousands of tiny, intricately convoluted tubules, and if there's any complication here, there could be terrible consequences.
The first issue was that, it's known that salt is important in blood pressure, and that animals that are sensitive to high blood pressure, you can make blood pressure a lot worse by giving them salt. And studies, from 1900 showed that if you took people with high blood pressure and you put them on a salt restriction, that you could lower blood pressure. So it's been known for a long time that salt is very important in blood pressure. And this has led to recommendations to restrict salt in people with high blood pressure.
People, when they're young, they can eat all the salt they want and they don't seem to have much of a problem. But as we get older, we become more and more sensitive to the effects of salt and blood pressure. After a decade of studying, we discovered that people with high blood pressure have low-grade inflammation in their kidneys due to T cells and macrophages, and they tend to be in the main part of the kidney where we call the tubules and around the blood vessels. The inflammation was keeping the kidney in a state where it couldn't get rid of the salt very well, and it did this by basically creating reduced blood flow to the kidneys. So in people with high blood pressure, they all have reduced blood flow to their kidney. When you reduce the blood flow, you affect the ability of the kidney to excrete salt, and you start to retain salt. Don't forget to like, share, and subscribe to our YouTube channel so you don't miss out on any of our life-changing videos. If you enjoyed this video, check out the Huberman hacks on the mental habits of the highly successful. Stay tuned.